I'm Eli Burgett out here at Wright State University, where a recent study has shown that untreated mental health cases are costing our region nearly $30 billion per year. Earlier today, I caught up with the people behind the study to break down their findings and what we can do to reduce this issue.
Instances of anxiety and depression that might have temporary effects on one's productivity or their personal lives in some way that does still have some sort of economic impact.
Thomas Trainer, former dean of Wright State University's College of Business, says that nearly 25% of people in our region are affected by mental health, either through a loved one or their own experience. Since 2023, Trainer's team at Wright State measured the effect of untreated mental health issues by comparing it to the region's gross domestic product, or GDP. The studies found that our region takes an estimated yearly loss of $12.17 billion in non-suicide premature deaths, $3.61 billion in deaths by suicide, and $6.57 billion in unemployment and non-participation. Combined with other lesser factors, the studies show that our region's economy loses nearly $30 billion per year due to untreated mental health cases, accounting for medical care costs and overall loss of consumers and workers. In a recent statement, Sarah Hockenbrock, CEO of the Greater Dayton Area Hospital Association, says in part, quote, "The magnitude of the annual burden is not just a number. It represents lost potential for individuals, families, businesses, and the community as a whole." While Trainer's study did not present a definitive solution to these economic and medical issues, he emphasizes the importance of employers when it comes to reducing behavioral health issues. Trainer says that employers in the Miami Valley should be willing to accommodate workers who are struggling and help them get the support they need. In general, he says this will result in earlier detection, greater care, and a more productive workforce.
If untreated, can impact their productivity at work. So they might be working and gainfully employed, but they are less productive, which of course affects the economy.
As always, we will continue to follow the impacts of behavioral health in our region. Scan the QR code on your screen for continuing coverage of stories like this on our homepage at Dayton247now.com.